All right, good morning, everyone. Before I start taking a few of your questions, I want to take a moment to say that nothing is more fundamental in our city than making sure that every family has the support that they need to raise a healthy baby and the resources that they need to make sure our children can continue to grow and to thrive. In 2009, Baltimore had the fourth worst infant mortality rate in the nation, but I refuse to let the status quo remain. We knew that in order to get a different outcome, we had to take a different approach. So we decided to roll up our sleeves and face the challenges together. In 2009, we launched Be More for Healthy Babies, a nationally recognized initiative. It is a coordinated effort to positively impact maternal and infant health in Baltimore. They determined that the second leading cause of infant mortality are sleep-related deaths. And so, in 2010, the Baltimore City Health Department joined with the Family League of Baltimore and Care First Blue Cross Blue Shield to launch Safe Sleep. It was a little tongue twister. Safe Sleep, our Safe Sleep campaign, to focus on combating sleep-related infant mortality. Since the launch of this Be More for Healthy Babies campaign, we have seen a significant decrease in the infant mortality rate. And today, we are proud to announce that in 2015, Baltimore experienced an infant mortality rate decline of 19%, an overall 38% decline since 2009. I think you owe yourselves a big round of applause. It's one of those things where I feel like we can't clap enough because when you hear the stories of the women and the families that have been impacted by sleep-related deaths or infant mortality, it is heart-wrenching. And to know that because of the work of all of you up here and our other partners who are not able to be with us this morning, there is a mother who will not face that grief, a father who will not have that pain, and a family that is now intact. It's just amazing. So while this is a fantastic achievement, I think it's a cause for celebration, but we're clapping and patting ourselves on the back, but we're not at the champagne popping yet because I think we still have more work to do. This is a call for further action. We know that the loss of even one child is too many. And we have to do more to help all of our families have healthy babies. So I want to thank our partners, CVS and Care First, for their continued partnership and their support with the Be More Healthy Babies campaign. We would not have been able to make this progress without all of our partners' support. I look forward to continuing our great partnership to give every child in Baltimore the best future possible. I'd now like to introduce Dr. Lena Wen to talk more about this fantastic achievement and our goals as we move forward. Dr. Wen.
Thank you, Madam Mayor. I want to first say that none of the work that we'd be doing, these great achievements, would be possible without the leadership of our mayor, Mayor Rawlings-Blake. And to see that she has really embraced this issue, I know that you have talked about the ABCs of safe sleep everywhere that you go. You discuss the importance of protecting our most vulnerable everywhere and just in what you do. And it's breaking down these silos, getting everyone to work together towards one goal. That would not be possible without your tremendous leadership. So I know that on behalf of our partners, we'd like to give you a big round of applause for your incredible leadership. Now, I also wish to thank many partners who are here today. I know you see this incredible coalition, and as we were talking about just prior to entering this press conference, none of this work would also be possible without our partners who have every step of the way stepped up and said, we know this is something that's difficult. This has not been done before. As our mayor was saying, in 2009, we had a terrible infant mortality rate in the city. And it's not just one thing that must be changed. Protecting the health of our babies requires so many different people working together. But our partners said, look, we know it's hard. We know it's something that will take all hands on deck, but we are so committed to doing this because it really is about the measure of how we take care of our most vulnerable. That is the measure of progress in our society. That's the measure of progress in our city. And that's what our partners have all committed to doing. So I wish to thank our partners who are here today, including Jonathan Rondeau, who is the CEO of the Family League, Tracy Kodak, our CEO of Healthcare Access Maryland. We have Molly Tierney, the director of our of DSS here. We also have Dr. Yvonne Bronner from Morgan State University, Shirley Sutton, the CEO of Baltimore Medical System, Natasha Peterson from the Family Tree Intensive. We have Bonnie Downing and Marie Grant from Care First, our really terrific partners. Bronwyn Maiden from the University of Maryland Medical System, Kathy Church-Balin from Johns Hopkins Center for Community Programs, Joy Tressergy from Healthy Start, along with so many other, I know that I haven't even come close to naming all of the over 150 partners, public and private, who have been involved in this incredible effort. And I wish to thank all of them for their tremendous work on the front lines with our moms, with our babies, in order to save lives. And so, I want to just say that already last year, we came in front of this group after a Board of Estimates meeting to talk about, at that time, an unprecedented drop in infant mortality. We talked about last time this unprecedented drop by 28%. We stood in this very room at around this time and made that announcement. And at that time, that 28% drop is already incredible. I mean, moving the needle citywide on a key health metric is very challenging. And that accomplishment was lauded by the Pew Trust, by the Surgeon General, the Department of Health and Human Services, our federal partners. Everybody said this is an incredible achievement and that we must do more. Well, today's announcement, I just want to underscore, is even more incredible and says so much about the work of our partners and our mayor and everyone in the city that we've had this 19% decrease in 1 year alone since last year. To move the needle even further to this unprecedented 38% decline is incredible, but also, to our knowledge, this is the lowest recorded infant mortality rate ever in our city. Now, we also know that it's not just a success to improve health in general if we're also not addressing the critical issues of disparities. And I want to announce, too, that we have continued to further close that disparity between Black and white infant mortality. And the rate for the infant mortality for African American infants has dropped by nearly 50% since 2009. Now, this is fantastic progress, and I'm sure somebody will ask at some point why this is so successful. Partnership is absolutely critical to this process of having all of the partners, after the mayor set the North Star of this is what we as a city have to focus on, all of our partners came together and said, we were all instrumental in coming together for these solutions that are evidence-based. So partnership, evidence-based solutions, doing interventions as early as possible, because we know that in order to protect the health of everyone, that we have to start as early as possible in infancy while the mom is pregnant, so as to give our babies, our children, the best chance to succeed. And our programs are also successful because we go to where people are. We provide services directly in our communities, directly in families' homes, in women's homes, with the individuals who are the most trusted in our community. We also know that education is the key to changing behavior, and the mayor has reminded us all throughout these last 7 years that babies should be put to sleep alone, on their backs, in cribs, no exceptions, the ABCs of safe sleep. And this is the best way to ensure that our babies are healthy. Now, we know that there is a lot more work to be done. As our mayor said, even one child, even one baby dying is one baby too many. And in Healthy Baltimore 2020, which is our new strategic blueprint for health and wellness in Baltimore City, we are addressing this through the lens of health equity, specifically to say that we want to combat these tragic deaths and to redouble our efforts to close that racial disparity that continues to extend in so many aspects of health in our city. Now, I'd like to introduce someone who has been instrumental in spearheading our Be More for Healthy Babies campaign. I feel very fortunate every day to work for a mayor who has been 100% committed to public health. And I also feel incredibly fortunate to work with an incredibly strong team every single day in the health department. One of our shining stars is Rebecca Deneen, who is our Assistant Commissioner of Maternal and Child Health. I wish to thank Rebecca for all the work that you do.
Thank you, Dr. Wen and Madam Mayor. Really, Madam Mayor, your leadership for the last 7 years has just been remarkable. And I have traveled to other places to talk about the Infant Safe Sleep campaign. And people say, how did you get the political support behind this? Because that's what we're really struggling with. And I say, I don't know. We just have somebody who's so talented and who really understood and had the vision and really took it forward with. So it's really, really amazing. And also to work with Dr. Wen is just like working with a lightning bolt. And there's just, so I really feel like there's so much possibility for the future. Also, just all of these partners, I mean, Jenna O'Keefe, who hasn't been mentioned, but she works for the Casey Foundation, has been partner with this for a long, long time. And her leadership is tremendous. But I do want to call out somebody in particular. Her name is De'Ara Matthews. She's really was the ambassador for the Safe Sleep campaign. Unfortunately, she moved to North Carolina. But if you ever see our 8-minute video, and now it's really short so that you can watch it very quickly on your iPhone, but she did a video around infant safe sleep. That video is shown across all hospitals in Baltimore City. It's shown at jury duty. It's shown in many different places. She really is an amazing woman who was brave enough to tell her story. And her story was sad. She lost her son, Charlie. And then we got to know each other, and she said, I want to work here, I want to work with this program, and she worked with us for many years, and then unfortunately left for North Carolina. But since then, in North Carolina, has given birth to a healthy baby boy, and we're very excited for her. So it's just a very heartwarming story, and thank you, De'Ara. Hopefully she'll see this news about our great success. So the last thing I just want to share is we have a Baltimore for Celebrate Baltimore's Baby event. It's on October 13th from 6 to 8 p.m. And it is at the aquarium, and it is free admission to the aquarium for Baltimore City residents. And we have 778 people registered. We have 1,500 slots, so we're really looking for other residents to register. But this is a way to celebrate with the people that are the most important and who are really behind the change in infant mortality, and that's the residents of Baltimore City. And so thanks to all of those women and men and babies and young kids that have contributed to making our city a better place. So thank you.
Thank you. Thank you, Rebecca. Thank you, Dr. Wen. Have any questions on our Be More for Healthy Babies initiative?
What are the raw numbers of, you said there's a 30% decline?
So there were 72 infant deaths this past year. There were 92 the year before.
And then you know the 2009 number?
The 2009 number of infant deaths was, I think, 128. 128. 128. Yes.
Any other questions?
And the strategies you put in place is education and
It's education which is important, and that is what I think a lot of people are doing, but it's not just the fact that it's education, but the way in which we're doing it. It is a strategic grassroots outreach. We are not hoping to get to people. We are being intentional about reaching people where they are and using people from the community to make sure that we are delivering this message. So I think that's what you're seeing, the results of our efforts to, and I said it in my remarks, if we wanted a different result, we had to use different strategies. And this, I think, is about this amazing collaboration of people who are committed to better for health outcomes for Baltimore's children.
So when a woman gives birth in a hospital, when is the first contact made, like through the health department to say?
Right, so I'll say that we start before a woman gives birth. I think it's important for people to be prepared. We think it's important for people to be prepared before they leave the hospital with a baby, to know what the expectations are in order for them to keep their children, their newborn safe. But I can have Dr. Nguyen or Rebecca talk directly to the outreach.
Rebecca will give you more specifics of the program. What I want to say, and this is the part that often is neglected in discussions about our Be More for Healthy Baby strategy. People see the healthy baby, or they see a baby and they think that's where we are intervening. But actually, Be More for Healthy Babies is a comprehensive strategy. It's about us saying, what are all the inputs that are necessary for that baby to be healthy? It's not just about what happens in the hospital. We know that what keeps people healthy is not just the health care that they receive at that point in time, which is very important, but it's about everything else too. And so we believe in intervening as early as possible. When the woman is pregnant, we have a system of triage so that every pregnant woman who is on Medicaid and who otherwise may be vulnerable as well is triaged in a central system so that they will then receive the level of care that would be appropriate depending on their vulnerability, on their medical risk factors, on their behavioral risk factors, on other perhaps they had a previous infant loss. These are all issues that we take into consideration, that the family may be assigned to have a nurse come and visit them, they may be assigned to have a social worker, they may be assigned to have a community health worker. The individuals then visit the women in their homes and give them services, including crib deliveries, education on breastfeeding, education on safe sleep practices. Sometimes, and our amazing home visitors have also told me just these incredible stories of perhaps finding that there is peeling paint in homes, and then addressing lead paint issues, or addressing other environmental hazards and allergens that may be not only causing harm to the child that is yet to be born, but also other children in those homes too. So I think it's important to realize that the strategy is about education for the ABCs of safe sleep. It's about home visiting, but it's also about identifying what other supports are necessary for that family to thrive. And that's why it's so important for so many of us to be here, for so many of our partners to be here, because all of our partners are involved in this process. But I think Rebecca may have other things to add.
I think Dr. Nguyen has really said a lot there. We had identified 11 high impact areas for improving birth outcomes, and those include reducing smoking during pregnancy, family planning, birth spacing, reduction of the teen birth rate, which has come down by 36% since 2009. So many different strategies. I think the thing that we want to emphasize is that's a life course approach. So to have a healthy baby, you really need to be a healthy teen. And to be a healthy teen, you really needed to be a healthy 6 to 11-year-old. And to be a healthy 6 to 11-year-old, you had to be doing well from 0 to 5. And so it's not every single year from the moment that you're conceived is important. And so thinking about things comprehensively really involves this life course approach. And so the strategy involves interventions at all of those levels, and particularly early intervention being very important.
Thanks. One thing that we didn't mention was we also do intervention around healthy weight during pregnancy, and that's something that is significant to me. So when you talk about this initiative and others that we've taken in the health department, I was raised by a pediatrician. I'm a mom. I get it. The health of our families has been something that I've been focused on since my birth. So I'm just very pleased that my administration reflects those priorities. So I want to thank you all very, very much.
Thank you.
All right, we're going to swap out and have a time for a few questions because I have to get over to Kennedy Krieger, right, Anthony?
So
Thanks, everybody.
we have about 6 or 7 minutes before we've got the exit from there.
Thanks again. Thank you. Oh, no, good to see you. I'm not, I'm not suggesting that they do. I'm merely putting on the table all of the states, all of the city's needs, or as much as we can as we go into the legislative session.
Well, why should the state taxpayers have any, this is the city police department, so why should state taxpayers have to pay?
It's the city police department, it's the city school system, it's the city roads, and the state taxpayers contribute to all of those things.
So did you share, based on your comments from a couple of weeks ago, that the even money was going to be on Senator Pugh being the next mayor? Did you share any of your requests with her?
Oh, absolutely.
What was her reaction, or was there any agreement, or did you two kind of collaborate?
There's been some definite coordination of the requests.
Have you gotten any response from the governor's office?
No.
Do you anticipate having a conversation? What do you anticipate happening next after you send this letter?
So we send a letter every single year, making a thorough list of the needs for the city. It sets the framework for the conversation as people prepare for the legislative session. That list is used by the governor, it's used by other legislators, particularly the Baltimore delegation as we prepare. They will have a clear understanding of the priorities of the administration moving forward, so they can make sure that they are in the loop. If there's possibilities to request an appropriation in those areas, they're up on it. If there's recommendations for cutting funds from those areas, they're aware of the significance of the request so they can better serve their constituents.
You say in your letter that the Baltimore Police Department is a state agency. Can you just explain, that this goes back and forth, we get this debate all the time. Could you just explain your view of that?
My view of that is Baltimore City is a part of the state of Maryland. It is the economic engine of the state of Maryland. So just as our infrastructure is important to the well-being of the state of Maryland, so is public safety in our city.
As mayor, how much input do you have on the city police, knowing it's a state agency outside of police commissioner?
You definitely have input. I approve high-level requests for promotions. We talk strategy. We also, I'm in constant conversation with the commissioner around, the outcomes and making sure that there's the significant engagement at every level to make sure that we continue to focus on having a safer city.
Is it not true that if you have to change policy through public local laws or whatever the mechanism, you have to go to Annapolis and ask for the changes and ask the rest of the state, hey, we need to do this in Baltimore?
Yeah, I'm not 100% sure what you're specifically referring to.
Whether it's a policy that's governed by state law or public local law or...
Yeah, I'm not going to understand it right now, your question. I can follow up with you and get you an answer on it.
You
Madam
can't,
Mayor, oh, sorry, go ahead.
Yeah,
can't
you're not
say-
going to be able to explain it, so I promise and commit to get you an answer for your question.
You can't
I
ex-
don't have an answer for you.
You can't explain
Yes.
whether or not you have to go to Annapolis to change the policy?
Kenneth, we're gonna move on. Mr. McGill.
Madam Mayor, with the police settlement this morning, the city solicitor said there was no evidence that a riot was performed. In 2016, what kind of evidence in your mind was there that police did perform rough rides on people or not?
Right, so I can't speak to the specifics of that case. What I can say is that we've put in place additional training for our police officers on everything from how we engage with community members, how we, after they're arrested, we've put in place use of force reforms to upgrade the police department in that way. We've improved the safety in the vans with structural changes as well as with video recording. So we're doing a lot of things to ensure that that rough rides don't happen in our city. But that being said, I can't really speak to the specifics of that specific case. And as you know, there are multiple reasons why settlements are awarded or agreed upon, and the evidence of an actual rough ride is just one of those things, right?
I mean, has there been
Yeah, I think, all right, this is what I know. You have any large organization, is everybody going to be doing the right thing every single minute of every single day? Absolutely not. Do we have a history of that? I think that that's an overstatement. While we hope that every single person does their very best every day, we set a very high bar, and I know that not everyone, that we have instances where there are a few that don't reach that high bar of expectations. The goal is to make sure that we are holding the department accountable, and that's why I've been fighting for reforms in the police department. That's why we make sure that we are doing everything to manage and to not, I don't want to say watch, but to make sure that we are aware of what's going on in the police department, encouraging not just from that supervisory level, but encouraging feedback from the community as well, so we can address issues as they come up.
Well, back to the DOJ just for a second. So if the state says, no, we're not going to give you money for this purpose, then what? How does the
We've
city, because it's obviously going to cost money, so how does the city pay for it?
So I've already started doing the work to allocate, well, not allocate, but identify potential sources of funds for the Department of Justice to implement the impending consent decree. And I've talked about it when we talked about our budget in the the fiscal 17 budget, when we made the presentation. I know that that was something that I spoke about as a potential cost moving forward that we would have to plan for.
Is that still the same number as a month or so ago when we talked about that, or has that changed in the last few weeks of analyzing what may or may not?
Yeah, I think what we're doing now is giving our best guess based on what we've seen in other jurisdictions and based on the size of our city and what we anticipate based on what we know about the work that needs to be done. Until we have an agreement, until we have a roadmap forward, we don't know exactly how much it costs, but we do our best to give an estimate based on consent decrees from around the country.
Folks, we gotta go.
Thank you.